Testing, testing.
Walang ano.
Check, check.
Check, sound check, test mic. 1, 2, 3, check.
Hello, Doc. Anahit. Good morning.
Good morning. Can you hear me?
Can you hear us well, sir, ma'am?
Yeah, sure. Let me switch on the camera. Okay, can you see me? Hi.
Just a moment, ma'am. Hi, ma'am.
Hello.
Boss pa siya nga kasi, ma'am.
Okay. Can you hear me?
Yes, ma'am. Anahit, we can see you.
Very nice. And I can hear and see you too. Thank you.
Just a moment, ma'am.
Okay. So
Can you hear the audio mic?
I can hear you, but very, very far from far. Can you hear me?
Yes, I can hear you loud and clear.
Perfect. Okay. Thank you.
So, nabalik ko yung card niya.
Two, hey, check. Two, hey, check, check.
in response to this COVID, which was a global phenomenon. And it's not rocket science to interpret this graph. On the left, on the y-axis, you have the ID systems, role of ID system in registration. And on the X, you have the payment system. In the top right quadrant is where you have digital payments and digital ID, making the reach of the benefits to the social protection beneficiaries easiest and fastest, and the coverage is the largest. So what is the summary? Countries that leveraged digital public infrastructure were better able to tackle the challenges of reaching the beneficiaries. Okay, so what is this digital public infrastructure? It's a buzzword, right? How many of you have heard it? Okay, then let me go a little bit into what is it. In the next slide, you will see that this buzzword, next slide. This buzzword has been defined differently by different people. Can you give the next slide, please? Yeah. So there are various definitions given by people on what is a digital public infrastructure. Each of these definitions you will see refers to digital systems, digital platforms, digital tools. And the examples listed in each of these definitions are identification system, payment systems, data exchange layer. Some extend this to include social registries, some include other registries. So these are considered as digital public infrastructure, which provide essential society-wide functions and services in the public and private sectors. So you can look at each of these definitions and interpret which one you like best and which resonates with you subsequently. But moving forward, you will see there is consensus on the role of, next slide, the role of DPI in digital economy. Nobody doubts that DPI is an essential ingredient for growth of digital economy. The number of components that you see, 5 at the bottom, is by CDPI. Some reduce it, some increase it. Then what is this? How does DPI benefit social protection delivery? If you see in the next slide, all the lessons that we have learned from the COVID response. From the past, we see that delivery systems played a key role, which we saw in the first slide. But what is the lesson for the future? Anybody? Okay, click next, you will see the answer. The lesson for the future, by analyzing all these COVID responses, more than 2,000 of them, one of the lessons was that countries have to invest in integrated and interoperable social protection systems now, before the crisis hits, not when the crisis hits. So this was the lesson. So how do we build these integrated and interoperable systems? Let us see in the next slide, what does a social protection program delivery chain look like? Most of these programs follow a typical delivery model where you assess the needs and conditions of the people, enroll them if they meet the eligibility criteria, provide them with payments or benefits or services, and then manage these beneficiaries over the life cycle of the program, including exit management. And how did governments or programs develop these systems? In silos. So each program had its own database, its own identification system, payment system, targeting mechanism, and these silos led to a lot of wastage of time and money in developing them and maintaining them. So should we follow this siloed approach? I think it's a no-brainer. No, we should follow a whole of government DPI approach. So with that approach, how does the architecture look? Let's look in the next slide. So if you look at whole of government architecture, you will have different social protection programs using, through a whole of government data exchange layer, the foundational technology platforms of identification, civil registry, payment system, and many other systems. So how do we achieve this whole of government integrated and interoperable system. You will see that in the next slide. How do we achieve it? Before we achieve, I want to just motivate this audience to see what it means from the perspective of a beneficiary. If you have no digital systems, imagine a country which 50 years, 100 years back, there are no digital systems and you want to provide social protection. So imagine an old person, John Doe, wanting to get an old age allowance. He has to physically go to a social program office, register his application. This application with all attached evidence documents will travel to the respective offices through snail mail, courier, or somebody taking on a scooter. And it takes a lot of time before you get a response that this person is genuine. He is really a senior citizen, an old person. And when this response comes, the person has to again show that I'm still alive, provide his bank details. And by the time the money comes in his hand through a van with big security guards, how much time has elapsed? 6 to 8 months. Now let's see if we were to digitize these systems in the next slide. You digitize the systems, but there is no interoperability between the systems. What happens? Now again, John Doe goes, or he can apply online, but the verification of his documents again has to travel over email because we have digitized, or over snail mail or postal. All this process of identification, eligibility check, and payments, it is improved in terms of the time it takes. But what is the time? From 8 months or 6 months, it has become weeks, 6 to 8 weeks by the time a person gets his benefit. Can we do better? Yes. How? Interoperability. Next slide, see the same scenario with John Doe, trying to do it with an integrated and interoperable system, integrated with ID system. Within few seconds, you can establish, yes, I'm John Doe. You establish that I am senior citizen, checking with civil registry, verify your bank account details, and then voila, within few minutes, the money is there in your account. And see the joy of John Doe, his happy face bubbling with joy. So how do we achieve this? Interoperability of systems. Next slide. Can you tell me how do we achieve interoperability? There's a gift for that answer. How do you, what is the essential ingredient for interoperability? So I heard somebody say that. Oh, yeah. Yeah, but there's a word inside in the slide itself. It is open standard. Somebody said it and your gift is with me. You can claim it when I come down. So open standards. Standards are essential for interoperability. And I agree with you that yes, institutions have to agree, and that is the process of consensus building. While in the health sector, you have standards, in the social protection sector, you don't have these standards. So multiple donors under the SPIAC-B, Social Protection Interagency Coordination Board, decided to launch this initiative after a study called Convergence Initiative for Development and Consensus Building on Standards. And this initiative was housed under USP 2030 to build and develop consensus on open standards for interoperability, which will enable countries to develop systems in reduced cost and time, enable them to mix and match components. So if systems are interoperable, you can interchange. If you had a charger which worked with all phones, would you carry multiple chargers, one for iPhone, one for Samsung? No, because of lack of interoperability, you cannot mix and match phones with chargers. Similarly, if you look at the cube, the different components, if they snugly fit into each other, I can change a component from open source to proprietary one or vice versa without impacting the whole cube much because the components are interoperable. So with this objective and goal, the Digital Convergence Initiative was launched to build standards. So what was the approach we took? In the next slide, you will see the approach taken by the Digital Convergence Initiative. First, we started by looking at what countries have done through our Talking Interoperability series, where we did a deep dive into the lessons learned, challenges, and how countries have dealt, the success stories of Chile, Turkey, some parts of India, how they achieved it have been documented and learned for the benefit of the whole community and the initiative. They're available on our website if that is of interest to the people. And some of the people sitting here have contributed to this knowledge from Pakistan and others. We have also built partnerships with initiatives working in similar projects like GovStack, Open G2P Connect, as well as with open source solution providers, because these solutions, when they become interoperable, can really help in building the DPIs. And not only open source solutions, but proprietary solution providers too. And taking these open source solutions by downloading them in our lab environment called the sandbox, we have demonstrated the power of interoperability, which you saw through the animation. We have shown that in action live. Based on these learnings, we have again set up standards committees, which are going to help in development of and consensus building of standards. These standards committees have members from various stakeholders, from international organizations, solution providers, and country representatives. In the next slide, you will see the first committee that we had set for defining the standards between interoperability of a civil registry system with a social protection information system. We have OpenSPP, OpenMS representatives here who have been part of this committee and have contributed to the mission of coming up with consensus-built standards, which can be leveraged as a DPI or a DPG, more as a DPG, digital public good, by all countries who still need to build their integrated and interoperable system. And countries who have already built them can contribute to this initiative, sharing their standards, artifacts to help others reach that same level. So if you want to connect with this initiative, next slide, you will see the social media handles where you can connect with us. So having motivated you on the need for interoperability using DPGs or proprietary solutions to create DPIs, which can be used for DPI for society-wide services, I will now invite presentations from 3 countries to showcase how they have done it in their countries. So the first one would be from Pakistan. I will invite Mr. Naveed. He is Executive Director of Benazir Income Support Program, and he will share the story of Pakistan with you all.
Thank you very much for having me here to present Pakistan's case of whole government approach for making our systems digital social protection systems. So if we can fix the presentation. So the sequence of my presentation would be in 3 phases. In first phase, I will just let you know what we are doing in the social protection so that you know the context. And then next slide, please. And then I will share it with you, the 3 dots which are important, which we actually connected for implementing our digital social protection. And then I will be sharing by connecting those dots, I'll be sharing with you the 2 examples. One before having the digital transformation and one after having the digital transformation, and what was the difference and how we improve things. And then I will be sharing the way forward in the last part of my presentation. Next, please. So we have discussed the outline. So if you can go the next slide. Next slide, please. So quickly, those who are not aware of what we are as a country, the country having population of 249 million, we ranked amongst 43 countries most exposed to poverty risks. 54% population is vulnerable to poverty due to health shocks. 21.9% of the population living below the poverty line. And if we take that, the World Bank's definition of the poverty line is around 39.8% population living below the poverty line. We have high number of stunted population, which is around 36.7%, and a very high number of out-of-school children as well. So in this background, we are implementing, next please, we are implementing the different social protection programs since 1980. But from 2009, we started a Benazir Income Support Program, country's largest social safety net program, focusing more on objective targeting, real-time electronic payments, grievance redressal mechanisms, co-responsibility cash transfers, and commitment to broader application of national social protection systems. So this program is the largest social safety net program of the country, being implemented since 2008. And this program is actually the result of all the lessons learned from all social protection initiatives that we, as a country, implemented since 1980. So next, please. So Benazir Income Support Program is actually established back in 2008 with the objective to enhance financial capacity of poor people, formulate to implement comprehensive policies of targeted program to uplift of underprivileged and vulnerable people and reduce poverty. So we have 3 core programs. One is unconditional cash transfer. We are covering 9.3 million families, providing them a regular cash assistance. Then we have 2 conditional cash transfer, one linked with education, in the background that we have a high number of children out of school, and one is linked with health and nutrition, we called Nasho Numa, and we have a very small program of undergrad scholarship as well. So this is the program's introduction. Next, please. So what are the 3 key important factors which actually helped us to make our program a digital program, digital implementations, and we call it a digital transformation. So first one is the evolution of targeting. We started with community-based targeting, parliamentarian-based targeting from in 2008, covering 1.98 million families. But soon we realized that we should move to some objective targeting. So in 2010, we set up a database, which was a paper-based questionnaire and survey we carried out all across the country, and built the registry of 27 million households and provided benefit to 4.4 million families through that registry. But in 2019, we have not only updated our National Socioeconomic Registry, but we use the technology. So we carried out a digital census, digital poverty census, to cover 35 million households of the country, like over 200 million population, which is roughly 87% of the total population that we had in our country. And with that database, we are providing benefits to 9 million eligible families. And lesson learned from the COVID, post-COVID. So we carried out this survey during the COVID, but the biggest lesson learned was, and I'll come to that, why COVID actually was instrumental to think about having a dynamic registry. So we then introduced dynamic registry components from 2023. And today our registry is dynamic, covering around 4.1 million population. So out of 35 million households, 4.1 million in last 3 to 4 months have already updated their information. And now we are not only dynamic in terms of changing in the socioeconomic status, but this registry is also a shock responsive registry. And we implemented many programs, not only Benazir Income Support Program, but all provincial and federal government programs, social protection program, are utilizing this registry. Next strength that, please, next, the next strength that we built over the years, next slide, please, is our National Database Registration Authority, which is our civil registry. So all our, this National Socioeconomic Registry is linked with National Database Registration Authority, having coverage of 140 million national ID cards, 198 million identities issued. 97% of the adult population is already covered. We have 86.45 million birth registration and 11.76 million death registrations. With that, we also have 134 million facial images, 1.2 billion fingerprints. So this National Database Registration Authority really helped us in verification of many things, like the verification of the ID of the recipient, not at the time of selection, but also at the time of disbursement of the benefit. So all our programs are validated through National Database Registration Authority. The third strength that we have is the technology-based payment systems. And that is too, we evolved over the period of last 15 years, started with the money orders back in 2008, tested this debit card, and now we have this biometric-based payment systems in place. So our regular programs, or even during the COVID or the flood, we use this technology of biometric-based verification system to disburse the cash assistance to the poorest of the poor. Next, please. So having these three dots, how we learned lesson out of this COVID to make it more dynamic, to make it more adaptive. So I will share two examples with you. One, this COVID example, and then the flood example. Next, please. So in the COVID, the issues that we faced is that, everything was closed, no economic activity, no savings. And the real problem that we faced at that time is the static database that we built between 2011 to 2019. And we never updated during that. So we had database of 27 million households. We validated it through NADRA's database. But the real issue was of the static nature of the database. So we were not aware that those who are affected and whether they are still under the poverty line or not, or the vulnerable population category or not. So we had to introduce some inclusion and exclusion filters using the administrative databases to exclude people. So we included people on the basis of our registry, but we have to exclude people on the basis of the recent administrative data. And that administrative data means the motor registration vehicles data, land records, consumption of the mobile phones bill, and all those information that we took from the different sources. And it took a lot of time to reach to a point where we identified 14.9 million families, through which we actually helped 14.9 million families. So we established special camps, established special touch points, and after verification of the biometric with the help of NADRA, we disbursed the benefits of roughly 216 billion rupees, which at that time was around $1 billion. So what were the challenges and the course correction that we actually helped us in quickly move to making the disbursement during the flood? So yes, static data for over 9 years, no inclusion and exclusions. Registry was not shock responsive, as it not catered to changes in the socioeconomic status of the household. Cost implication of the door-to-door activity for each registry update. Payment mechanism had challenges largely due to financial illiteracy and implementation of biometric-based payment systems. A lack of administrative data access, compatibility of integration, lack of digitization, and data completeness issues. So these were the few challenges through which we learned the lesson, and we did the course correction. And now we have the regular update of database to mitigate inclusion and exclusion errors, shock responsive registry, operational cost of registration and targeting have significantly reduced, a beneficiary-centric payment model with inclusion of all financial institutions, and collaboration for API-based two-way data exchange and transfer to help other organizations to implement their programs quickly. So on the basis of these course correction, we implemented our flood response, which was very quick. Like within a week of flood, we were in the field and not only able to quickly identify the affected population, but we also able to quickly disperse the benefits through our digital payment platform. So National Disaster Management Authority was responsible to identify the areas. They identified the areas, we identified the population, especially the bottom 40% population, through our updated dynamic registry, and with the help of partner banks through biometric verification of our civil registry, we were able to start disbursement within a week to roughly 2.8 million 2.8 million families affected by the flood, and we disbursed around $450 million and provided this benefit of $125 per family quickly. And we were the first one as a social protection program, even before the disaster management authorities of provincial governments go for any rehabilitation and help, or even for the assessment. It was first time in the history of Pakistan that any disbursement in case of disaster made within 1 week of the disaster. And that is only able to, that was the main instrument was our registry payment system and the civil registry. So what is the way forward? And when I'm presenting the way forward, probably half of the things that we have already done to reach to the stage of interoperability. So we have now a dynamic registry in place. So we started with 35 million household static NSCR digital census. So we now established 647 dynamic registration centers all across the country, which was not there before COVID, before 2022. So we did this, and this center is actually being used for registration of the households with their change in the socioeconomic status. So they don't need to wait for the door-to-door survey for providing the information and to become part of the program. So whenever they feel that their socioeconomic status is changed because of any health shock or any climate or any shock, they can come and they can register with us, and they will have the update socioeconomic status. And we provided them different platform. They can also come to the desk. We are launching very soon, and next month we are launching the public app through which they can also register. And we are also introducing mobile registration vehicles for covering far-flung areas. So this system is currently linked with our civil registry on real-time basis. So whatever information that we are getting from the people, we are verifying then and there to let the people know that we have this cross verification system in place. So with that, we are also linking it with the administrative data on real-time basis. So since we have a few questions linked with administrative data of provincial governments, like we have the data related to, we have questions related to ownership of the vehicles, ownership of land, ownership of livestock. So what we did is that we are integrating our dynamic registry database with different databases for cross verification to avoid and to minimize the risk of inclusion and exclusion error. So this is something that is going forward, making our system interoperable by linking it with the government departments, linking it with Federal Board of Revenues, by linking it with other administrative data. And we'll come up with one beneficiary registry that is real-time linked with NADRA's database, which will help not only BISP to implement their program quickly, but will also help the other social protection program to run their program effectively. And they will have a live information available on people having their having change in their socioeconomic status. My last slide is actually next is focusing more on what is our future in terms of setting up social protection BI infrastructure for anticipatory actions. So we are going to have our data to be placed on cloud. So all the organizations working in the social protection will have the access of this database. So they don't need to ask for the data to be ISP. They don't need to request. They will have the live access, and they can use it on real-time basis for the purpose of their implementation. God forbid, if there is any disaster, they can put the required information, and they can put the required parameters, and they can get the required information accordingly. So this is the vision that we have, and we are working on this quite rigorously, and we are hoping that this will be in place when hopefully I'll be presenting this presentation anywhere soon in any conference. So with that, thank you very much, and I would love to respond to your questions.
Thanks, Naveed, for sharing the journey of Pakistan, and the way forward looks very, very impressive. And we will be interested in seeing, when you reach your goal of integrated beneficiary registry and social registry. With this, now I invite Kiran Anandam Pillai, Chief Executive Officer and founder of iDrishti, and also volunteer as advisor technology in the National Health Authority of India, to share the journey of India.
Thanks, Anita, and good afternoon, everyone. So happy to be here to present what India has been doing in this journey of digital public infrastructure and how it's been using it in social protection. Next slide, please. Next slide. So I think like Pakistan, India is, of course, very large, very diverse, lots of different languages, also very, very good mobile penetration, but very low, as you can see, percentage of people in the formal economy, people who pay income tax are still very low in the overall system. Next slide. And if you really go back in time, back in 2008, one of the big challenges that India used to face was that it had very, very poor penetration of bank accounts, only about 17%. We also had huge challenges in targeting and delivering direct subsidies with a significant amount of what we used to call as fake beneficiaries and leakages. Next slide. Now, one of the things that was, if you had looked at that time, at the pace at which India was issuing bank accounts, if India had continued to do that at the same pace, we estimated that India would have actually taken 46 years to actually get to about 80% penetration of bank accounts. Next slide. But actually, India could actually do it in about just 6 years. And this was really only possible because it took a technology-based approach and it took a DPI-based approach to actually changing how it worked in terms of delivery. Next slide. So we'll talk a bit about what is the DPIs that India did to achieve it, but what this has done is it has actually made one of the largest direct benefit transfer systems. Is based on the same two things that I think you've seen in Anita's slides and Naveed's slides, which is about creating a digital infrastructure on the ID side as well as on the banking and the payment side. And so we have now a humongous number of federal schemes that are adopting it, and there has been a significant improvement in delivery of direct subsidies or direct benefits through this systems. Next slide. So the digital public infrastructure story in terms, and in our minds, digital public infrastructure is only when you have the government building certain digital building blocks as the public part of the digital public infrastructure, but essentially opening it up through APIs and allowing a certain amount of innovation that comes in from private ecosystem participants. So almost all of the strong digital public stories, public infrastructure stories in India revolve around this construct of the government playing a role in some of the blocks, but most importantly, enabling and bringing in the private player ecosystem to build solutions on the top of this infrastructure. And I think that's been one of the key learnings of India. Next slide. So the very first system that India did is the identity infrastructure. So in fact, I was telling that the original scope of this was to issue a unique identity or identifier for every individual. So the system could have stopped there, but I think the innovation that really happened was to build an API on the top of that infrastructure that essentially offered a service of eKYC. So in the very bottom, you can see 13 billion eKYC transactions. So eKYC became the single most important thing. So for the bank account story, the reason we were able to do it is because for starting a bank account in India, the cost of a KYC, which is the proof of identity and the proof of address with physical paper forms, used to be over $1. And with the identity infrastructure coming in with an API, a bank could actually get an eKYC done in under 2 cents. So a humongous change, instant identification could be done from anywhere. And that's what actually drove the pace of which bank accounts got opened in India. Similar to the Pakistan story, this is the primary driver for physical presence of beneficiaries. So in Anita's story, I think we saw an old man having to give the proof of whether they're still alive to get pensions every year. So in India today, people use this system where the bank actually comes to your home and collects your fingerprint so that you can continue to get pensions. So it's really powerful in terms of service delivery too. So a core thing that I think one of the first infrastructure that people need to do is not just a foundational ID infrastructure, but really the set of API architectures that enable it for a service. The law in India actually says this has to be purpose independent. So the authority that runs it only can say, hey, here is a request for you to say this is Kiran, but what's the purpose for which it's being requested is not supposed to be known even to the authorities. So it's got a lot of privacy preserving aspects in its design too. Next slide, please. So the second thing that India has really built, which is amazing, has been, apart from using the identity infrastructure to really improve the penetration of bank accounts, is to build a real-time payment infrastructure. So this is the world's largest real-time payment infrastructure today. So when this started, it's called UPI in India, stands for United Payment Interface. Again, it's a set of APIs. It's run by one organization that's half owned by the banks and half owned by the government. And essentially it offers free rails for a whole bunch of private ecosystem partners who have built solutions that make payments possible. To understand the contrast of this is just about 4 years ago, or I think 5 years ago, the number of merchants in India who would accept either a credit card or a debit card used to be just about 1 million people. And merchants, especially smaller merchants, the systems were not very good for them, because if they had to pay about a 1.5% to 2% of the money or a transaction fee on that, they would actually refuse to do it. So you can imagine a small seller on the street not wanting to use digital payments. India today has more than 35 million merchants who use UPI. So anywhere in India, if you visit, you will find every merchant, including the smallest of them, displaying a small QR code. You will find people scanning with their phones and making a payment. And the government essentially, as a digital public infrastructure, has made the cost of the transaction zero for all players. So if you transfer 100 rupees from you to the merchant actually gets 100 rupees. And a subsidy system has been put in place to make sure that all participants can actually cover their costs and make some money. So this is the other big thing that has happened. So this is running into billions of transactions now, which is actually driving a huge number of things in India. Now, this combination of these two infrastructures, next slide, please. This is showing you how India is now in the world, especially when it comes to payments and real-time payments. So you can see, compared to the other countries, that in the last 3 to 4 years, India has really overtaken when it comes to real-time payments. Next slide. So one of the key things about the digital public infrastructure approach is, I think, you can have an all-government approach, or next slide, please. Can you click on the slides? Or you could have the big tech approach. And I use this example of maps as an example. All of us use Google Maps, but it technically should be a public infrastructure. But of course, it's in the hands of a few big tech in the world today. And that's happened for many different spaces. But we think that the digital and public infrastructure approach, which uses a mix of the governments having to create certain infrastructure that's useful for the public and allowing the private ecosystem to come build on the top of it, is the new way for countries to go forward as they think about their own digital empowerment out here. Next slide. Now let's look at a couple of examples of how this DPS have been leveraged specifically for social protection. Next slide. So the first thing I want you to realize is that India has now reached a point where the identity system actually covers about 90% of the population, definitely a very larger number when it comes to the adult working population. The banking, as we already saw, has covered about 80% of the population, and the mobile phones are now at about 85%. But what's important is the need to have linkages among all three. So in India, it's called the JAM Trinity. So one of the initiatives that the government took was it made it quite important and mandatory through a variety of both legal as well as through programs to make sure that everybody had their mobile phone linked to their identity system as well as into their bank accounts. So which means today, if the government wants to target a payment to a beneficiary, it can actually use the national identity. And there's a system called an AEPS in India, which is, it can actually push a money transfer to an identity and it will go to an associated bank account. So if you want to do an authentication, you can actually trigger it off your mobile phone. And so this combination is actually a most powerful DPI ingredient, which is very useful in India. Next slide. So this was actually used for a very interesting scheme. So the government wanted to do a life and an accidental death and disability cover. So there were 2 schemes that were launched, and all they did was they made it super simple to enroll. In fact, the simplest way in the way in which bulk of the people enrolled was by simply sending a single SMS saying, I would like to be part of this program. So as simple as that, they could use the information because the mobile was linked to your bank account. The bank account had a KYC, which was linked to your national identity. they could use that to issue a policy, and they could also make sure that they could do recurring policy contributory collections just from that single act. So that was the very powerful thing. Next slide. And you'll see that because of this, they were actually able to reach humongous populations. So for one scheme, which is the accident and disability cover scheme, they managed to reach 341 million people through this process, 162 million for the life cover product. But what I think is more interesting was gender diversity. So 51% of the enrollments have been from actually women. And about 71% of the people who are doing this were actually rural. So I don't think traditional issuance of any kind of social protection or coverage could have reached these kind of numbers of scale without the leverage of the digital infrastructure. Also, an excellent this one that because they have contributed, even though they're very small amounts, to participate in the scheme, you also see very good awareness about the product when it comes to claims by the family. So that's the big thing that has happened. So next slide. Same infrastructure has also been extensively used during COVID. Very, very large amounts of cash transfer depending on different segments that the government wanted to cover were done using the same infrastructure. Next slide. Now, India has actually now started to take this approach of digital public infrastructures where it has built these three common blocks and it's starting to expand it sector after sector. I've just used two sectors actually. India is driving this in more than about 10 to 15 various sectors. So one of the next things that you'll see coming out of India is actually a huge thing for credit, specifically targeted at small and medium businesses. So one of the big areas that the economy struggles with is making sure credit happens easily to these segments. So India is building new public infrastructure that will essentially use data from a variety of sources to enable a small business to actually get credit from multiple competing banks, which will use the data to come up with a score and actually offer the credit. So that's one of the core areas that's happening. I have been actually working with the National Health Authority in India on a second area, which is the health sector, where we have identified and designed digital public infrastructure on what does healthcare need. So similarly, if you can think of identity and payments as very broad for any sector, we are now looking at, what are the digital public infrastructure that makes a difference to a sector like healthcare or agriculture. So that's the second place that's happening. So the two kind of things that we're working on, one is a national health claims exchange, which actually redefines how health insurance claims work, and a national health information exchange and consent manager, which redefines how we move health data around for your care. Next slide, please. Now, India's journey, and the good part of India's journey is that it has a big focus on standards. And I think I saw a few names in the alliance that Anita put up, and we are very participatory on the standard side because the belief is that it's best done with open standards and open protocols. So all digital public infrastructure, we believe, should ideally come there. And we hope that there will also be implementation samples or examples. So all of these icons you see on the right side, they are actually open source components. So any country that's interested in either adopting the standards or taking a open source that can help them get started, it's all available for other people to look at as they take forward their own DPI journeys. Thank you.
Thanks, Kiran, for sharing this amazing story of India. And I think with the G20 presidency of India, this has become very well known to a lot of people. And I hope a lot of countries can benefit with this digital public goods. With this, now I invite a virtual participant. Anahit has been waiting for quite some time. Anahit Parzian, Director, North Technology Center for Social Services from Armenia, will present this story from Armenia virtually.
Dear organizers and dear participants, thank you very much for hosting me online. I have to say sorry for not being in person together with you in Manila. This is because of difficulties we have and the crisis situation in Armenia with the humanitarian crisis we have here. And I hope that I can share some information regarding how to handle crisis situations concerning social protection during big and different types of crises, and to share our experience with that within that respect. So I would like to ask whether I should share the screen or you should go with the slides, just a technical ask a question, please. Okay, very nice. So I will quickly and very shortly go through the slides. So our organization is providing digital services to social protection, which actually includes more than 75% of the population. And we try to make the digital transformation in social protection as a single approach. That design is based on the interoperability with other digital platforms and digital infrastructure on a national level, which will provide us to a human-centric approach and will design all the needs for our clients, for our beneficiaries, before even they apply to any social protection services. What does that mean? I will ask you to go to the slides, please. Next slide. Yeah. So we have to maintain and design the development of social protection digital services and platforms that provides human-centric approach and identify all our beneficiaries before even they apply to our services. We provide services before a person is born, so a mother can apply to social protection services when she's pregnant, and we provide services after the death of a person that the relatives can apply for social benefits. So we take and provide services to the whole circle of life, even before and after. So throughout this journey, we try to make sure that all our platforms are very interesting for them, very easy to use, and of course, based on accurate data that is interoperable and real time, together with other partners and other state governmental organizations. Next slide, please. So we find out that one of the basic components that we have to focus on designing this type of approach is, first of all, digital by default, which means that we do not transfer and digitalize just our applications that already exist in our real time. We transform them into the digital logic, which means that probably some of the laws and legislative orders must be transformed to the digital ideas, and so that our beneficiaries will feel comfortable and will not be asked several questions for the same time. For example, if they are connected to national identification system, they just need to apply the PIN code and they can be defined, their identity can be defined, and all the information regarding their personal information regarding to that specific benefit, social service, will be included already and pre-filled in the application form. So they don't need to write information about their, for example, about their address, about their income, about their ownership, or any other information related to them, or their status of disability. So all information is already exchanged and interoperable with other data systems, and it is involved into the application already pre-filled for them. The other thing is secure by design. If we take this kind of information into consideration and we make this interoperability real time, it is important to make sure that the design, the concept of the platforms are in such a way that we can protect this information correctly. So we design a lot of structures with firewalls and different types of interchanges, both within our systems and the other systems, so that this information is never duplicated and not preserved in several parts of this exchange system. So it is only single approach, and it is preserved and asked within the specific database where it is generated. So it is not duplicated in other parts. Privacy by design is also based on the unique identification platform. Now Armenia is in the process of making this whole national level, but there are different layers now being implemented. The one that we're going to input to our all social protections is that unified one. It is linked to the mobile application, mobile card, and it is connecting and identifying the person, connecting it to the national authentication system so that the person can easily, with biometrics, be defined. We design our platforms as with a human-centric approach. We think that a person should not be asked or have any difficulties while approaching to our social protection services. So we have a big business analytics, which we call deep business analytics. So we find our target groups and we make sure that the questionnaire, the design, the concept, the timing of our applications are specifically designed to our specific target groups so that they feel comfortable while using our applications. For that part, we also use intuitive user experience, which means that considering the fact that social protection can also include marginalized groups and very specific needs must be considered, they feel intuitively, easily navigatable our platform. So we do this design with an intuitive user experience. This next slide, please. So we have very types of applications and very many different types of platforms, but I will talk specifically about several platforms that I would like to share on a specific examples how we maintain these applications. Next slide, please. We find out that whatever we do in our social protection digital transformations is leading us to make people's life easy. So we call them life-changing platforms, because if they apply to our platforms, definitely they need a decision which will somehow affect their life. And we make sure that this life-changing experience will be for them productive. And our experience, our approach is to give our clients, our beneficiaries, the best experience we can, because we'll not only provide social protection services to our population as beneficiaries, but also we provide services to the ecosystem that provides services to our beneficiaries. So that's why we differentiate between services and between specific services to our environment, in our ecosystem, all the companies that provide services. This is also the interoperability, not only, and having this inclusive approach also within an ecosystem, because you can not only focus on governmental interoperability, you have to also include and invite your environment and to build this ecosystem of transition of information within the same secure and easily applicable API system management platform. So, but actually, I would like to mention here that we also exchange information not only within a government, but within our country, but also outside our country. So we built this platform, which is called Work for All. This is interoperable with the Russian Economic Union. 5 countries, Russia, Belarus, Kazakhstan, and Kyrgyzstan, and Armenia, exchange information about their employees states and provide employees can provide information about their job announcements, and job seekers can find information within these 5 countries. So this is interoperability between 5 countries, which is also based on exchange systems. So we did database mapping and data mapping with 5 countries to make the vocabulary and data sets applicable to each other so that we can do this interoperability fluently and on a real-time basis. Next slide, please. We also integrated AI and machine learning in rapid social response platforms to make sure that our analytics are not only accurate, but also we can have predictions and we can have information that is actually more advanced in its fraudability and more advanced in its processing part. So next slide, please. So AI integration help us to monitor such platforms as not only rapid response, but also we include it in other social protection platforms. And we can have the fraud detection before even the visit started to the specific home. And we can also select only those that are higher in fraud detection scores and not best money and resources to those that are not fraudable within this design. So this is an innovation, by the way, to integrate AI and ML in social protection. And we are happily sharing this because this was very much also helpful to have our partners to help us, that is the ADB. And we think that this joint project can have different developments further and applicable to other social protection services as well. Next, interoperability. A good example of interoperability is our new platform, which is a new assessment of functionality of people with disabilities. This is the concept differently designed currently because we do not measure the disability of a person, but we measure the functionality of a person despite having these disabilities. So we connected these data sets to national identification system, to digital health system, to education, to all possible data sets that are very much connected to any information that is relevant to measure the functionality of a person. At the same time, we digitalize. I think the slide has changed. Am I right? The slide that is visible. Oh, okay. No. You can go back, please. So we designed this exchange system with other data sets, so we can actually have these 5 main processes real time, which means that online some VNet processing specialist can access to the information from all database already pre-filled in protocols and suggested by the system to them, so that we can definitely eliminate any kind of human mistake. At the same time, they are capable, and these platforms are editable, so that in case of human approach is needed, they can edit it. But at the same time, they are suggested by specific protocols already calculated. So the second part of this slide, you can see the dashboard of a specific schedule. We automated scheduling of doctors that are designed to that are invited to participate in the committee for these assessments. And this is also an automated approach which connects all kind of information regarding to the patient, the benefits, the beneficiaries, the doctors, and also the available places. And by exchanging the system, suggest to all the doctors already registered in the data set whether or not specific scheduling is okay to their schedule or not, and they can accept and deny. This system is very much useful. We did a lot of research and monitoring among the beneficiaries, and 95% are satisfied with this system approach, and we want to continue and to make it all national level approach, including also those who have done physical disability assessment before within the former type of legislation, and now they can move on to this new one. Next slide, please. So I would like also to share another interesting and innovative approach of our new 2 platforms that we've launched last year, and also we are using it right now. As you might know, due to military aggression of Azerbaijan in Nagorno-Karabakh, historical Armenian nation is now forced to flee from these territories, and now we're having a humanitarian humanitarian centers that have to give specific social services to these people, and the flow is very high, and the humanitarian crisis is very much now in action, and that was one of the reasons that I couldn't come in person. So we launched these two platforms, one of which is collecting information about people who are in needs. That's a short questionnaire. They fill in information about themselves, and this is linked to the national identification databases, and we can identify that person. We asked about what they need, what kind of needs do they have. We have specific data set of needs, and here you see a map. What is this map about? This is about the donors and NGOs and other organizations who would like to provide specific to these people. So we link the vocabularies and the data set. So these organizations are also linked to the data set. So we identify them as not physical entities, but as companies and organizations, and later on they can put that information on the map. For example, they can put information about how many people they can host, or how many people they can provide hygiene boxes and other type of things. So we have these monitoring systems real time, which make us to go further and help people on a very quick way. Although the flow is very high, it's very high to manage this in a 1-2 days, but this platform has launched already, and more than 200 organizations are here right now, providing whatever they organizations have the mandate to do. In contrary, we have people defining what needs they have, so that we connect these platforms and see within which location these people can have the access to the needs they see. So this is making the distribution of resources very easy, and on a high level you can monitor the systems. We also link this information to Power BI systems that we have as a reporting tool, and real time we can see the needs and the distribution on our databases. Next slide, please. So the last platform that I would like to talk is that we managed to launch a platform which is called eSocial, which is connecting all that platforms that we have managed to do within these years and we had before. So all those that are processing and becoming within a new digitalized strategic system, we put it here. And this platform is designed in such a way that it defines and finds the target groups we already can see. For example, if the government decides to launch a program for marginalized groups, we already can identify these groups. And when they want to apply, we can find them if they have ever been our beneficiaries. If this is not the first time they apply to our platform, we can identify and ask them, would you like to, you are eligible for this program, would you like to apply to this? This is our target that we're launching. Technically, this platform is already ready, but we are designing on the services that we need to provide. Now, social benefit system is being launched, e-disability is being launched. We're working on the employment services to be deployed here. And once all major sectors will be included here, we have here self-assessment toolkit. What does it mean? A person applying to social protection can just ask what services he or she are eligible to apply. And the platform, based on the data space and interoperability, can define and suggest all possible ways. But a person should go to identification platform, which is the second part of this picture, as you see on the screen. By mobile identification, we can accurately say which services this person is eligible for. Next slide, please. Yeah, we finished with this part. I would like to also mention that we are putting a lot of efforts on making these platforms more human-centric, as I've already mentioned. We are putting this as our final and the most important thing. For that reason, our company, North Technology Center, we developed Social Protection Digital Index, and I would like to invite our colleagues for further discussion and for further development of this Social Protection Digital Index, which measures all the processes that any person can have with interaction social protection. That is application system, dataset exchange system, decision making, reporting and monitoring. We put specific indexes so that we can see which country and which company is where within the digitalization processes and where and how many still things to be done to go further and to digitalize. So by this, I will finish my presentation and I'm looking forward for discussions. Thank you very much.
Yeah, thank you so much, Anait, for the presentation. So I invite our last panelist, Saurabh, who is an advisor at GIZ and leads the OpenMS initiative, which is a digital public good, about which he will be sharing now. And in the meantime, you can start thinking about your questions. After this, we'll open the floor for questions.
Thanks, Anita. And I know I'm eating into your lunchtime, so I promise to be short. And then we can get into the question answer session. So to preface my presentation, we looked at a lot of examples, and I wanted to take this opportunity to look at digital public goods, which could be a way that various countries and practitioners could look at achieving what India, Pakistan, and Armenia have also achieved. So next slide, please. So first, let's look at what digital public goods are. Like, what does this term mean? And this definition that you see on the screen, as from the Digital Public Good Alliance, it can be broken down into two parts. When we say digital, it's not only about software. No, it's digital technologies. It could be tools, systems. It could be standards. Any products that relate to digital. So that's what we're saying when we're talking about digital. And public goods are basically a commodity or a service that are made available publicly, free of cost, either by governments or by private institutions. And when we look at it as a whole, to make digital public goods, software or tools, publicly available for free, we're looking at this concept around open source. No? So this is a modality, licensing products as open source, to make it available publicly. Next slide, please. So what does this allow? Having these digital public goods and using them, they basically allow for us to not have to build systems from scratch. Now we can really, we've seen that various, during this conference, the problems that we want to solve in social protection are the same within a country, among different countries. So why should we have to reinvent the wheel? And that's been the concept of today as well. So DPGs allow for this. You can build on top of software, you can take knowledge products and build on top of it so that you're not having to start from scratch all the time. And the way this is possible is basically because the knowledge is also available. So digital public goods also don't only mean that the software is available open source. A fundamental concept is also that the knowledge around the software is also available. So you don't need to rely on the person who wrote the software and made it open source to continue to evolve it. So the knowledge is also available open source. And what that means is, for practitioners, this means quicker turnaround. You can really have digital systems implemented at a much faster pace, that are better tested, that are more secure. And I know this is a concept that takes a while to get into, where open source is and has proven to be more secure than even proprietary solutions, because there are more people working on it. There are more people to find and fix the vulnerabilities than closed systems. So this is all what DPGs allow, and ultimately allowing us to have better quality products out there. And we've seen in all the presentations today how important it is for multiple systems to work together. DPGs work with a lot of standards on various aspects for exchange, and it really allows for integration of multiple systems together to build a coherent architecture, which we will see as a digital public infrastructure as well. And all of this is really looking at having sustainable digitalization, because that's a problem that we all face. It's easy to start a digital process. It's easy to develop software. It's easy to deploy software. But having the software run, being maintained 5 years later, this is a challenge. And DPGs really give us this option to keep it sustained for a long term. Next slide, please. So let's look at one very brief example from the OpenIMIS initiative. And this example comes from Africa and the Gambia, where during the COVID pandemic in 2020, the government, through its National Nutritional Agency, introduced a COVID-19 relief cash transfer scheme. They had the resources and they wanted a very quick turnaround. They wanted to initiate payments within 1 month of the policy decision. Gambia being a small country, it was possible in terms of numbers, but still having all these processes in place to get payments out where they didn't have any infrastructure was quite difficult. They contracted a private IT company to build the MIS to manage all of this. And this IT company realized that they won't be able to make this turnaround of 1 month of having payments out there unless they use digital public goods as their base. And they chose to use OpenIMIS, which at that time was primarily used for a lot of social health insurance schemes, but had the basic foundations of a system that could be used for this. So they already had beneficiary management. They had the data, and OpenIMIS already had the data analytics capacities. Payments were also integrated as we were managing contribution payments, not outgoing payments. So this company built out a payroll management module on top of OpenIMIS and a payment reconciliation module. So they only had to work on these two. And they actually made the 1 month turnaround. And this was only possible because they were able to leverage what was already there. So the success was not only for the company. So the company was able to provide the results to the government of Gambia, but also for the global initiative. The OpenIMIS global product now suddenly had cash transfer functionality, and that not only the Gambia, but anyone else in the world could use. And this is really the power of digital public goods. This is the sharing. One country develops it, they invest it, but now anyone else can use it. And it also set us, OpenIMIS, on a different trajectory as well. Now we were more confident and now capable of addressing different social protection schemes. So from then onwards, and now OpenIMIS has also evolved to provide more functionality and technical capabilities into social protection schemes. Next slide, please. So now we've talked about DPGs and what they are capable of, and looked at an implementation example as well. So DPGs, we believe, are a very good way of establishing digital public infrastructure, because infrastructure needs these tools. So DPGs for DPI is a lot. There's a lot of work going on worldwide around this, primarily because it allows for sustainable digitalization by removing dependencies from technologies and vendors, because this is important. Governments need to be able to not have vendor lock-in to their digital technologies, because it will hurt in the long run if you have only one vendor that can provide your digital services. And it allows for peer-to-peer exchange. But at the same time, to have all of this, I'm saying that DPGs are a solution, but it's not that just because you use a DPG that all these problems will be solved. Careful planning is required. You need to have plans to integrate the private sector into your DPG use, because they are the service providers as well as academia. So a lot of careful planning is needed, but DPGs are a solution. So with this, I would like to end, and thank you very much, and looking forward to your questions and exchange on this. Thank you. Over to you, Anita.
So I think the other sessions have broken for lunch. So we can take a couple of questions and also allow you to network and talk to the panelists during lunch. But if there is any question for Anahet, who would not be available in person, please go ahead. Do you want to sit there? online.
Hi, my name is Numan. I'm from Pakistan delegation. My question is to Kiran, precisely like there are three questions. One is on the subsidy. Who is covering it? Is it the government? Because as we understood, it's 50% each, public and private. So who is covering the subsidy? One. The other one is on the health insurance. So good to know 341 million people have opted it. How much time it took? And considering the I'm just relating it with Pakistan, like the digital literacy they have, how much the communication was a challenge and how have you dealt with it? And if we have time, just last question on the claims verification. How much that process has been digitized? And if there are any manual processes in claims processing, what are the challenges there and how have you been dealing with them? Thank you.
Hello. Yeah, thanks. So I think in terms of the, I'm sorry, I think I missed the very first question, subsidy payment. Yeah, so the subsidy is actually coming from for the payments infrastructure. So the UPI payment infrastructure today is to make it free end-to-end between the citizen as well as the merchant, for example, because there's three players involved. There is the entity that runs the digital public infrastructure. It's called NPCI in India. So that requires money to run the infrastructure. Then there are actors, which is the banks, which is holding the bank accounts, which need to support the infrastructure. And there is also app people with the mobile phones on which you're scanning, who also need to kind of cover for. So the government actually came up with a subsidy, which is the money goes into NPCI, and then NPCI actually breaks up and makes payment to all the actors depending on the volume. So that's how the current system actually works. In terms of the second piece, for the accident and this one insurance, the claim processing is still offline in the sense it actually goes through because what was simplified was really the fact that I'm saying I'm signing up for a policy. But the actual policy, there was a tie-up between the banks and an actual insurance company, which did the risk part of it. And so the claim process was actually done by the insurance companies. But the fact that they could digitally verify, they knew the KYC of the individual, essentially made the process because they were primarily doing accidental death as well as life-term cover. So that part wasn't, the actual claim process was not digitized in this particular piece. Same thing when it comes to health insurance. In fact, the work that we've been doing in India on the health insurance side is actually to digitize. Right now, about 99% of the claims in India go through manual adjudication on the health side. And it actually, it's not a very efficient process. It's quite expensive. And so one of the key digital public infrastructures that we are coming up with is something called a National Health Claims Exchange. And the whole protocol across both, India has many different health insurers, both public and private. We have come up with a single e-claim format, which can be used to file a claim from any software from any of the providers. And it will actually get routed to any processing agency or insurer, and they can deal with a lot more auto adjudication. And the intent is to bring down the cost of claims. A lot of health claims in India are still only for inpatient. And as India tries to go from inpatient to full UHC, which has outpatient claims, we expect the number of claims to go up exponentially. And so it's quite important for us to digitize this process at this point. I hope that helps.
Hi, thank you very much, Jeremy from OpenSPP. There was a mention before of using AI in case of emergency for targeting. How is it used, and what are the safeguards there to avoid bias and problems like this?
This question is for...
Yeah, I think it was yeah.
So Anahit, are you still there with us?
Yes, I am. Thank you very much for
Is
the
Anahit
question.
there online?
I am.
Okay,
I am.
Anahit, you can respond to this question.
Okay, thank you very much for the question. Yeah, this is the very interesting question because every time we think about AI, the ethics comes out, and we're thinking about social protection and AI system and people with marginalized groups and the all ethical parts. So, what we decided to do, we tried to integrate AI systems just as a suggestive tool. We're not automatically making decisions based on AI decisions, but we're integrated these systems into as a helping tool for our social protection services, deliver those who deliver these services to people who make decisions. For example, if we have applications and we process this application and we see that the fraud detection is, for example, up to 10 points, it is 8 point, 9 point, or 10. This is the highest possibility of fraud. It means that other circles of monitoring systems must be included so that we're sure that this case is not fraudulent. But all other cases like 1 to 8, it is not a risky level. So other monitoring systems are not included. So what other monitoring systems are? We do extra home visits. We integrate other social service protection staff to investigate this. So this is extra budget. So in this case, when we don't have these risky fraudulent marks, we do not put these monitoring systems on a case level, but we do it on a system level. So this is one system how we do this. The same is also in other parts. We do it as a suggestion. We do not make decisions based on AI.
Thanks, Anahit. If there is anyone last question, yeah, please. Yeah. I can't see them, but
Yeah,
you can go ahead.
congratulations. I really found this session so very interesting. Just a question, maybe Naveed, Kiran, but again, Anahit, you might be able to respond as well. One of the difficulties, or talking about dynamic civil registries, how do you verify the information? You talked about cross verification because this is how you determine whether the beneficiary continues to be eligible for the next round of benefits. So how do you cross-check it when it's already into the system? Thank you.
Can complete it. Yeah. So these questions also to him only. One is, what is the mechanism to verify the credibility and genuinity of the persons registering under Social Protection Registry program in Pakistan? And the second question is like, in the support of NORC for the Armenia social protection system, what is the strategy and plan for the government to take the systems or the maintain it within its capacities? And in Pakistan, how strict is the country's data privacy protection policy? How do you ensure data protection if there is plan to also make the data readily accessible from the cloud? So these are the questions.
Okay.
Thank you.
Yeah, so you also have a question? Yeah, I think we can have and then can respond.
So yeah, I will be very quick. So basically that there are a lot of different populations in the different countries, and then some of the countries might not have direct access in the country to the companies who has the capacities to build this kind of systems. What would be kind of like the way forward or the roadmap for these countries to be able to access maybe the private companies and then what would be basically steps to start to have this this system for the social protection and even the whole of government system in place?
So on your question of data validation, so basically, yes, when you carry out the door-to-door surveys, probably that could be the first tool that you use for verification. But that is why in my presentation, I mentioned that we linked our database with not only civil registry to verify their credentials about their, about their gender, date of birth, and marital status, this demographic related information. But also for the assets related information, we are linking it with the administrative databases. So we have sets of the questions, probably linked with ownership of the vehicles, ownership of the land, ownership of the livestock, and then even ownership of the electricity connections and their consumption, gas connection and their consumptions. So we are trying to link it with that and cross-validating it from those resources, from those sources. So although it's important to have the data validation, but I used to say every time, as you believe on the tax returns of the rich people and you don't ask for the cross verification, you should believe on the poorest of the poor as well, that they are not telling you lie. There is always an inclusion and exclusion errors there, but I think there are two important things. One is that you can fix it through the survey tool that you have. So if you are having a scientific based questionnaire developed, you can always minimize the risk of misreporting. And the second thing is that you can minimize through linking it with the administrative databases. So like, let me give you one example of our dynamic registry. So this poverty scorecard tool usually give more weightage to a family having a high number of dependent or having high number of the people in the household. So when we used to have a door-to-door survey, when the database is not linked with any civil registry, so any household, if they tell we are 8 people, we have to write the 8 people, and they usually get the margin. But by linking it with the civil registry, so if they are telling that there are 8 people in the household, it has to be verified from the civil registry, yes, that whether they have 8 people in their household or not. So through that, you can always restrict them from misreporting and can have authentic information available.
Thanks, Naveed. So based on the online questions, if you just want to take a 30-second response, Anahit.
Yes. Yeah, I would quickly say, as Naveed also mentioned about the validation that is happening on a periodic parts. We have the same validations every month regarding all the data sets on a specific service delivery. For example, for social benefits, we are doing this exchange and data validations every month so that they can, before they get these services. So if anything is changed within the basic rule-based regulations, they can be cut from the services or they can be eliminated for some part of the services. If something is changed within the datasets that are not valid online via administrative registers, for example, paper-based documentations, because not all registers are digitalized equally and parallel. So we have home visits to check extra. So this is a difficult situation when you don't have the digitalization level of all registers in one time, but still the validation is per month for every part, and based on that, the decisions can be changed automatically.
Thanks.
Just quickly on the data protection, yes, we are. What we are following is that without the consent of the recipient, the data cannot be accessed. So they have to provide the national ID to an entity for accessing that database, and that is the confidential information that we have. So without that, no one can access the information. Like, we are not posting the national IDs of the population at the cloud, but the data can only be accessed by providing the national ID, and then they can access that information. So if someone is sharing the national ID with any entity, then only they can access the information.
Thanks, Naveed. So I'll give you the last question.
The same is in Armenia also. Nordic Technology Center, by the way, the question was how we manage the data set as a company. So we're linked to the Ministry of Labor and Social Protection. So the data systems are definitely being under the regulations of data protection. So we're basically based on that regulations.
And then on the last question on how companies can really get started with this, and that's one of the points with if the use of digital public goods are encouraged, digital public goods have repositories of information, not only code, and those act as capacity development materials. If I give the example of, let's say, the OpenIMIS initiative, we put developer starter kits, implementer starter kits online as well. So anyone interested in implementing or building a business of implementing these could refer to them. And maybe at some point there's some capacity development offers as well. But generally, digital public goods have this, no? So when the knowledge is available, then companies, they would need to invest their time, but they do have a way of building knowledge and expertise on it. Thanks.
Yeah, thanks, Saurav, and thanks to Kiran and Naveed and Anahit for responding to these questions. We now break for lunch, and you will have time to ask any unanswered question you may have. Thank you all.
Thank you very much. Goodbye.
In front of the glass.
No, but I'm going to contact. Okay.